Patients who are unable to move around, even for short periods of time, are at risk of a number of health problems. Some of these problems can be treated, but others cause permanent impairment and can result in patients becoming bedbound or chairbound. Muscle weakness can lead to balance problems and unsteadiness. When patients try to walk small distances, they often have the feeling that they are going to fall. Everyday tasks, such as washing and dressing, become more difficult. This leads to a greater dependence on others for assistance. Muscle atrophy or wasting can result in foot drop, a condition which causes the front of the foot and toes to point forward. Patients with foot drop find it difficult to walk and tend to drag their feet instead of lifting them when they take a step. A contracture is a permanent flexing or bending of a muscle in the arm or leg. Contractures cause the muscles to shorten, so it is not possible to extend or straighten the limb. This makes it difficult to hold objects or walk properly. Pressure ulcers can result when patients are unable to change their position in bed or in a chair. Lying or sitting in the same position puts additional pressure over bony prominences such as the hip bones. Poor moving and handling techniques cause shearing and friction, which can graze the skin. These broken areas can develop into pressure ulcers if not treated. Hypostatic pneumonia, a type of chest infection, can be caused by patients lying flat for a long time. Respiratory secretions remain at the bottom of the lungs, as patients are unable to expand their chest muscles to breathe deeply. They may also have difficulty coughing, so they cannot clear the sputum from their lungs. Deep vein thromboses or DVTs are blood clots that form in the deep veins of the legs. The blood circulation of patients who lie in bed for long periods becomes slower, allowing blood to pool in the calves. This is known as stasis. Patients who undergo long operations, such as hip replacements, often wear anti-embolic stockings to prevent DVTs from occurring. Being immobile increases the risk of urinary tract infections or UTIs, because urine tends to remain in the bladder for too long. People who are immobile and who use long-term catheters, for example people with paraplegia, are more prone to developing urinary infections. Thanks for watching. Specialist language courses.